Okay. Then we will come to your arm. And all reality, I've already talked about the clavobrachialis coming all the way here. The epitrochlearis is this muscle that's on the bottom part of the ventral side, which is the front side of the cat, that I'm lifting up right here. Epitrochlearis sits actually on top of the triceps. I can see the triceps underneath the epitrochlearis. I see the triceps better on the back of the cat. But this is the epitrochlearis, and it sits on top of that. Okay, they don't have a biceps brachii like we do. Then we come to the forearm muscles. On the ventral side, that's the front side, you will be asked to identify the brachioradialis twice. Okay, because I can see it on both sides, the ventral and the dorsal side. So here is how I do the arm. I usually try to find the palmaris longus, which is the most recognizable forearm muscle. The most recognizable because it's the thickest and it has this white tendon sheath on it. Palmaris longus should be the easiest forearm muscle for you to identify because it is the widest, the longest, and it has this tendon sheath on it. Once I find that, I know there's only one muscle underneath the palmaris longus, and that is the flexor carpi ulnaris, which sits underneath it that I'm pulling up right now. Okay? So if I have a muscle on this side identified underneath the palmaris longus, then you know it's the flexor carpi ulnaris. Palmaris longus, right above the palmaris longus, and I know there's two muscles, but we don't need to know the profundus, is the flexor carpi radialis, right above the palmaris longus. Then I have the pronator teres. It actually is kind of smaller, and it comes in, it starts about midway in the forearm and comes down and around and inserts towards the back of the elbow. But it's smaller, and it comes in at an angle as the pronator teres, and then the brachioradialis is at top, on the top. I'm just trying to give you some clues to help you because there are 5 forearm muscles here and they're not the easiest to figure out. But if I go from top, brachioradialis, next one underneath it that's a little shorter but it comes all the way to the back of the elbow is the pronator teres. Next one is the flexor carpi radialis, then the palmaris longus, then my flexor carpi ulnaris at the bottom are my forearm muscles. What is this tough layer of fascia called? The aponeuroses is here. This is the antebrachial fascia. Remember that big sleeve you had to cut open? I will definitely be asking that question. All right, so now I'm going to come down here to the legs. If I look here, all right, the big muscle that is going to be superior above is the sartorius that we haven't cut through or anything like that, and it's usually a little darker colored. The muscle down below it underneath the femoral vein and femoral artery, which is this blue and red, is the pectineus. That's the one you had to, skip that. This is the gracilis, sorry. Okay, this big muscle on the lower part of this leg is the gracilis. Sartorius on top, gracilis on the bottom. Then, in order to find the other muscles underneath, you had to cut through the gracilis and find them. Pectineus is very small. It's usually darker colored, and it sits right next to the femoral vein, which is this blue. That's the pectineus. It's not very big. Then I come through, and the adductor adductor femoris is the next one, which is this muscle right here, and then the adductor longus is that one that you're going to not see unless you flip the gracilis all the way back. So pectineus, adductor femoris, adductor longus. Now I come down here to the lower part of the leg. This big muscle is your calf muscle. That's the gastrocnemius. I do not see the soleus unless I pull the gastrocnemius back, because the soleus is actually attached to the gastrocnemius. So it's up underneath there. So listen, if I have a pin up underneath the gastrocnemius, make sure you know what it's pointing to, and that's going to be the soleus. Then the muscle that is on the underside of the tibia, because the tibia is the bone right here, is the flexor digitorum longus. That's right by the soleus. And then in front of the tibia is the tibialis anterior. So, sartorius, gracilis, pulling this back, pectineus, adductor femoris, adductor longus, gracilis, soleus, flexor digitorum longus, tibialis anterior. Yes.
So is that different than humans?
Yes. Yes. Yes, it is. Yep. Okay. That's everything on the front. Questions? There will be a word bank tomorrow. Okay. There will be a word bank.
Yeah.
Okay. Now we come to the back. Now remember, we have one big trapezius. They have three different trapeziuses. Well, not really a word, but you have the clavotrapezius on the neck. You have the acromiotrapezius on the shoulder blades, and then you have the spinotrapezius underneath the shoulder blades coming to a V. So the three trapezius is clavotrapezius, acromiotrapezius, spinotrapezius is the lowest part. This big muscle right here underneath the spinotrapezius is the latissimus dorsi. That's what I said. It's most likely going to be on the back, because look how big this muscle is. Alrighty? So that is the latissimus dorsi. I come up here, okay, and I'm going to turn this over a little bit. You have two deltoids. We only have one. All right? They are going to have the spinodeltoid, which comes off of the acromiotrapezius up towards the top. The spinodeltoid kind of runs off a little bit off to the arm. And then, to be honest with you, not really. Oh, right here, okay, that muscle that the spinodeltoid runs into that comes across is the, excuse me, acromiodeltoid. And I said while you guys were trying to find it, it's like a T. Spinodeltoid comes up, acromiodeltoid comes across. So the acromiodeltoid is what crosses the top line of that T. Okay? And it's a smaller muscle. It's right there. This right here is the clavobrachialis. Like I said, you can see it from both the ventral and the dorsal sides. Okay, now, you do not have to identify the different heads of the triceps. If I have a pin sticking right there, you're just going to tell me it's the triceps. There are three different heads, but you just have to identify the triceps. One thing that many of you, and I don't think they did either, do a good job of finding, is the brachialis. The brachialis is going to be a muscle that sits between the triceps and the clavobrachialis. So if I pull both the triceps and the clavobrachialis away, that is the brachialis. It sits nice and neatly right in between them, right here in the upper arm. A lot of us, I don't think, found that. But that sits right there. That's the brachialis. And I have to pull the clavobrachialis and the triceps away for you guys to see it. Then, when we go to your forearm muscles, you are going to deal with these 5 forearm muscles again. And again, what's the one that I'm going to find on top? Is the brachioradialis, okay? Which is this guy right here. So the brachioradialis is going to be this one on top. This next one that comes in is the extensor carpi radialis longus. Then the next one is the extensor digitorum communis that I'm picking up right here. Then this one is the extensor digitorum lateralis. And then the bottom one right here is the extensor carpi ulnaris. I don't have as good of a reference in the forearm muscles on the dorsal side because they're all very similar in size. But brachioradialis, extensor carpi radialis longus, extensor digitorum communis, extensor digitorum lateralis, and then the extensor carpi ulnaris. Think about the ulnaris being the bottom muscle in both the front and the back sides. Alrighty. And again, they did a great job because this cat is very nice and clean. So don't feel so bad, okay? No cat envy here. This is just a really nice cat. You come down here for your butt muscles. So your gluteus medius is this muscle right here, all the way at the top by the lumbodorsal fascia. Then the gluteus maximus is this muscle right next to it. And then the caudofemoralis actually sits on top of the gluteus maximus. The gluteus maximus, they kind of made a line here, but that actually is covered, part of it is covered by this caudofemoralis that's coming out. We do not have this muscle. Cats do, but we don't. This would actually just unite with the gluteus maximus. So gluteus medius, gluteus maximus, caudofemoralis are your three butt muscles. Then you come back here, your big muscle coming all the way in the back is the biceps femoris. Okay, think about hamstrings. Biceps femoris is right there. Then I have my semitendinosus that is cut right there from the biceps femoris. And then you had to dig away all the fat to see the semimembranosus, which actually sat underneath all of that fat. You can see on this side, you don't see really the semimembranosus because you had to cut away all that fat. But once all that fat's gone, then that's the semimembranosus. Questions?
Can you go over like the gluteus and stuff?
Yes. Okay, so here's the lumbodorsal fascia. You do not have to take any of that off because there's no muscles we have to find there. So right at the base of the lumbodorsal fascia is going to start the gluteus muscles. The first one is the gluteus medius, okay? That's going to be right up here, right after the lumbodorsal fascia. This one that is next is the gluteus maximus, right here. And then the caudofemoralis, if you notice, sits on top of part of the gluteus maximus that I can't even see part of it. So the caudofemoralis sits right there. Then biceps femoris, semitendinosus, semimembranosus.